Empathy is another skill that is difficult to incorporate in real-time conversation for some people. And I want to start by giving some tips before actually giving some language ideas of how you can incorporate it. So from what I have observed as I've trained people for the OET is that empathy can be said, but it also needs to be expressed. So we have this expression or this phrase, it's not what you say, it's how you say it. So I would caution, as you're thinking of empathy, be careful about just memorizing one phrase or one response that you repeat again and again, because it can actually start to sound ingenuine. So not like a real sense of feeling what the patient is feeling or feeling sorry for them in that moment. So a couple of tips to make sure that the empathy is genuine. The first one is just avoid overusing one statement. What tends to happen, I think, as we are nervous or we're in a situation that is stressful, is we tend to resort to just using the language we know. And if you've only memorized one statement or there's only one you feel comfortable using, what tends to happen, there's a lot of repetition with that one statement. So I would recommend have some variety, practice with that, so when you get to the exam, you can use different phrases pretty comfortably, and it can convey that sense of just genuine empathy there. The second thing is to let the patient finish before responding. So if the patient is giving lots of information about something, just wait until they finish, then respond appropriately. I think as well, because the OET speaking section is timed and we have a limited amount of time, we may want to rush the patient, but it's quite important because the patient also has a roll card. They have certain things they need to say, so let them finish before you jump in with your response. The other thing to consider is that usually when we think of empathy, we think of responding to the things the patient says that are sad, concerning, worrisome, kind of that reassurance element. And certainly that is mainly this idea, empathy, stepping into that person's shoes and feeling that emotion. However, there is also opportunity to empathize in a positive way, so feeling that positive emotion with them. And I recommend looking out for this in the role play. So for example, if the patient has made changes or improvements, or maybe something wasn't as bad as expected, and they express their positive feeling about that, that is also an opportunity for you to empathize in a positive way and respond to the patient with those positive phrases. The final one there is this idea that actually using the patient's name can convey some empathy. So if you said, for example, Rachel, I'm so sorry to hear that. That must be challenging for you. There is a deep sincerity of using that person's name and they feel comforted by it. So not all the time, I wouldn't say after every statement, but don't be afraid to include the patient's name throughout the conversation. I would just caution, watch the tone. If the name is said more forcefully or in more of a direct manner, it can come across as a bit condescending. It should be reserved or used if you're expressing empathy, but I think if you're explaining things, if you're going through, I would just be aware that how you say the patient's name can affect how that is perceived. So those are some tips for empathy and just some things to watch out for as you are thinking how you can incorporate that into your role plays.